It's a pleasure to be here. Shall we get started then, George?
Yes, please do.
Okay, perfect. First of all, I want to say that I was looking at myself in the camera and I noticed that I'm extremely red. And I just wanted to assure people that I have not been day drinking and I'm not suffering from heat stress. So just be rest assured that that's not the case. I think it's something to do with my camera. So I apologize for that, first off. I'm actually going to talk about something we've been working on, and it's near and dear to my heart, heat stress and wildfire smoke. And I'm actually going to provide some case studies that we've been working on within the film and television industry. So I'm going to give you a little bit of background first on heat and wildfire, and then talk about different ways we can assess heat stress risk and wildfire smoke risk. Going to just provide a very short comparison of different jurisdictions, just a flavor for sort of the differences that are around in North America. Not very many states and provinces, but just a taste really to give you that sense. And then we'll talk about those case studies. So we know climate change is abound, and we have been hearing about it in the media more and more. So as George was saying, we've been involved with this wildfire fighter work for several years now. We just finished a season this year, and it seems to be getting worse. Like, we really notice it just having worked since 2019. We've been noticing the change in like 5 years or 4 years, really. It's really quite incredible what we're seeing. So just a little bit about heat stress. I'm sure you're already well aware. We as mammals, we like to be within a certain narrow temperature range. And when we get out of that, our body doesn't like that. So we try to deal with excess heat. And if we can't...
Mona, sorry to interrupt. Are you sharing your screen?
Oh,
any chance?
I am sorry.
No worries.
That is very important, isn't it? Okay, I'm glad you told me that. Sharing. Am I sharing now?
Yes.
Oh,
that's great.
Okay, perfect. So when we have excess heat, we can develop some heat disorders, heat cramps and rashes, dehydration, syncope, we can faint, exhaustion, and stroke, which is a medical emergency. There's different ways we can assess heat stress risk. And so these are just several ways we can do it. And many of these are acceptable methods under WorkSafe BC guidelines. So we're probably all very familiar with the wet bulb globe temperature method, which is the method that's also within ACGIH, or the American Conference of Governmental Industrial Hygienists threshold limit value booklet. So we're probably all as hygienists have learned how to use the widget and quite familiar with that sort of gold standard. However, there's other methods that are acceptable as well. So you can see here this little baby, this little baby is getting their core temperature taken. So that is a method that's acceptable. Of course, workers don't really love getting their rectal temperature taken. So tympanic and oral is also acceptable. Recovery heart rate, we can use that as well. And something called the Humidex. So we can use a Humidex. We'll talk a little bit more about that later. We actually built an app for IATSE 891, which is one of the unions for the film and television industry here in BC. So if you want to follow along later, you don't have to, but if you want to download this app, you can download it on the App Store for iPhones and on Google Play for any Android phones. So if you want to do that, I would encourage you to do so now, so that later on when we get to that section and I show you the heat stress app, you can follow along. So we did this sort of cursory jurisdictional comparison between different states and provinces, and we just looked at what's acceptable for heat stress risk assessment. So I told you about WorkSafe BC already. We talked about the widget method, the recovery heart rate and core temperature, Humidex, but also you can use dry bulb temperature. So as you can imagine, if you use one of these methods, they're not going to be comparable to another method. So like if you say a dry bulb, if you're at this dry bulb, you have to do these things. You're not taking into account any of the humidity. So of course, if you use the Humidex method, you might be implementing controls before you implement them using the dry bulb method. So that is very interesting how Of course, if you measure differently, you're going to have different results. And then we talk about sort of trigger temperatures. And what I mean by that is like, when do you have to start doing something? So WorkSafe BC says, you know, about 23 degrees Celsius, you need to start thinking about heat stress and sort of asking yourself about whether there might be some heat stress risks. And then there's also some guidelines that say at 30 degrees and above, you need to put in an exposure control plan, for instance. But of course, it differs if you are using different methods for assessing risk. So Ontario also allows for WIBJIT, Humidex, and heat wave alerts to assess risk. And they have sort of different triggers. And there's multiple triggers. I wouldn't get too held up on the numbers. I'm just trying to show the differences. So with Washington, OSHA, we have a dry bulb that's mentioned, but it says you don't have to record the temperatures. But it does mention supervisor training. It's currently under revision. And you can see the triggers are kind of different depending on what clothing you're wearing, et cetera. And they're all in Fahrenheit, and I've translated them into Celsius there. And for Oregon, they allow for dry bulb, heat index, which is similar to Humidex. It's sort of like a feels like temperature based on temperature and humidity. And then Cal OSHA also says you need to have supervisor training. They have to understand the factors, et cetera. You need to monitor, you can monitor weather reports, and you can use a dry bulb thermometer as well. So just in summary, there's just like the full gamut of just even 5 jurisdictions. They're all quite different. So what I'm trying to get at is really that every jurisdiction is different. So when we built this app, for instance, we had to say that this meets WorkSafe BC guidelines using the Humidex method, but it may or may not meet your jurisdiction's, regulation or guidelines. So my first poll is, what are acceptable methods that WorkSafe BC has for assessing occupational heat stress risk? So I don't know, Angela, if you could put that up there. Oh, great, thank you. And I'll give you some time to fill that out. And I was told to wait till 80% participation, but it seems to have stabilized.
Yeah, I've just stopped
Is it okay?
Okay.
Okay.
Yes.
Okay, great. So we have most people answering ABC, which is correct. Yeah, great. You were listening. That's great. Okay, so wildfire smoke. When we deal with wildfire smoke from an industrial hygiene perspective, it's, this mixture, this soupy mixture of all this different stuff, just like diesel exhaust, for instance. So, it has carbon dioxide and water, carbon monoxide, the combustion smoke itself, which consists of char, that's irregular carbon particles of unburned material. There's soot, which is the finer carbon material that comes from incomplete combustion, and then ash, which is burned cellulose material. And there's also chemicals that sit on these carbon particles, like the polycyclic aromatic hydrocarbons, which for the work that we're doing with wildfire firefighters right now, we're looking at polycyclic aromatic hydrocarbons, PAHs, and looking at interventions to try to reduce their exposure to these PAHs. So that's very common on these particles. We have hydrocarbons, nitrogen oxides, sulfur oxides, volatile organic compounds, mineral acids, and even trace metals. So it's a whole mixture of different things. So as an industrial hygienist, you're like, oh, what are we looking at? What should we look at? So different exposure concerns from wildfire smoke. We have like a lot of like lung irritation and lung inflammatory responses, asthma triggers, immune system suppression, changes in lung function, even like cardiac disease and cancer. And then, of course, we have susceptible populations to wildfire smoke, like infants and children and people with chronic or pre-existing respiratory conditions, pregnant women, people with compromised immune systems. So you might think, oh, well, in a working environment, in the film and television environment, oh, are you seeing these groups of people? And yes, we are. We're even seeing infants and young children because, of course, we have the actors that come into play as well. So when we look under the microscope, we can actually detect the char particles. So this is like electron microscopy of char. And so you can see there's these black chunky bits that you see there. And then if you compare it to something where there is no char that hasn't been contaminated with char, you don't see that. So you can actually do comparisons of that. We've done some forensic work in the past where we've had to identify whether the smoke, that settled on surfaces is actually coming from something outside or is it coming from something inside. And so one time I remember doing that, doing some wipe sampling, et cetera. And this was a insurance case. And we noted that actually most of the soot that was landing on this white furniture and all this, all the furnishings, et cetera, was coming from candle burning. So the person was actually doing a lot of candle burning. I saw a lot of candles around with wicks that were really long. So, you weren't getting efficient burning, right? And so there was a lot of soot that had settled in on these surfaces. And when we took samples and looked at under a scanning electron microscope, we could see that there was carnauba wax that was associated with the soot particles. And then we could determine that the wax candles were actually made of carnauba wax as well. So it's kind of fun to be able to do sort of this forensic analysis to be able to tell where that smoke might be coming from. So for wildfire smoke assessment, when we talk about like, any kind of occupation, there's really, there's lacking information on occupational exposure limits. In BC, we don't really talk about them. And I guess it's a new issue from an occupational perspective. There's public health ambient air quality standards, which are really good and useful, but there aren't any occupational exposure limits at this point. Some of the ambient air quality standards, there are wildfire smoke specific ones, which is really, really useful for us. And most of those ambient air quality standards around smoke are measuring PM 2.5. So if we look at the different jurisdictions again, just a snapshot, you'll see BC has this air quality health index, the AQHI, which has a rating scale of 1 to 10. And the contaminants it looks at are ozone, PM 2.5 and 10, nitrogen dioxide and sulfur dioxide. And then US EPA has what's called an AQI, an air quality index, has a different scale, it's 0 to 500, but they also split it into 6 levels of good to hazardous. Same contaminants it's looking at. What's very interesting is Cal OSHA has an occupational guideline or regulation that says that's based on AQI. So it's using an ambient air quality standard, but it's actually giving it an occupational lens. So they're saying AQHI of over 150, so 151 to 500, you need to start doing stuff. You need to do communication, you need to do training, you need to start enacting some controls. So that's really interesting if you look at that, that CFR. So AQI above 500, which is hazardous, past this level of 0 to 500, you have to wear a respirator. That's what they're saying. It doesn't really work in the film environment. As you can imagine, the actors cannot wear a respirator while they are outside filming. So we have to come up with sort of different plans. But there is something in the literature out there. There's something that other jurisdictions are using. They also are just looking at PM 2.5 for this AQI. So in BC, we have this smoke optimized AQHI plus, which is really helpful for us because when we're looking at AQHI, for instance, we want to be able to relate it to a PM 2.5. So here you have PM 2.5 on your left, and then AQHI, and then your risk category. And then there's health messaging for people at higher risk, health messaging for the general population, and then just general controls that anyone can implement. So this is really great. I love this chart. And I say to all the employers out there, you need something like this. You need something like a control plan, really, to tell you what are you going to do at certain levels. Because I would get these calls on a Saturday morning and people would call me in a panic and go, should we be filming outside? What should we be doing? And I'm like, you know what? It'd be way better if you planned ahead and then you could recognize, when it's too smoky to film outside instead of, trying to deal with it after the fact or during the fact, I guess. So my next poll question is, what is in wildfire smoke? There you go.
Almost there.
Great. I think overwhelmingly everyone got the right answer there. All of the above and more, actually. Okay, so I'm just going to move on to this case study in the entertainment industry at this point. We know that in the entertainment industry, in films, etc., sometimes they create their own heat stress. So I've been on sets before where they've burned sets. They want a fire scene, for instance. And my colleague and I, Taryn Toic and I, we've been on a set before where we're surrounded by fire. And we were there with our widget going, is it too hot? And so then we noted when they had to shut down the propane bars, etc., and dissipate the heat, etc. So we would be in these environments where they would actually create their own heat stress risk. But for the most part, the heat stress risk comes from an external source, right? It's because it's hot outside. And that's a little unusual for industrial hygienists to have to deal with. Normally, we deal with stuff that the employer or the company or whatever is producing themselves. They produce the contaminant that we have to control. This is an external hazard that's happening, right? And so it's a bit different than what we're used to, but we can still apply similar principles. So depends on what they're doing. If they're outside, like there's a scene here in a desert. My sister is actually a film director. Her name is Mona Shum, and she was doing the Murdoch Mysteries in July in the middle of Toronto in the middle of summer. And it was 30 plus degrees Celsius, and probably the humidex was way higher than that. And they were doing outdoor scenes where they're wearing like 19th century winter petticoats and things like that, and like large winter coats and things like that. So they had to really pay attention to heat stress risk, right? Because you're supposed to be pretending it's winter time outdoors on a really hot summer's day. So it's sometimes a bit of a struggle to try to control those risks. And of course, with live events too, we hear about more and more heat stress related incidences, and even with wildfire smoke now, with cancellations, etc. This is becoming more commonplace that we have to worry about heat stress at these live events. So what we did was we took the humidex, which is an acceptable method by WorkSafe BC. And the humidex method is really just a translation of the widget method into humidex values. It actually is finding a humidex value using relative humidity and temperature using this graph below. And you can measure the temperature and relative humidity with a hygrometer. So now we have digital hygrometers, which is that one on top there. But then there's the one down below, which you can still use. It's the sling psychrometer. I don't know if UBC still has one, but I remember when I was a student, we actually took a sling psychrometer out, and we wetted the wick, the one bulb, which is the wet bulb, and then the dry bulb stayed dry, and you swung it around. That's why it was called a sling psychrometer. And that would give you the relative humidity too, if you compared it to a chart. Either way works. People do prefer the digital digital hygrometer these days. So with the humidex method, WorkSafe BC says you can only use it. You can only use it when you're not exposed to direct heat, like infrared radiation from industrial equipment or hot surfaces, and then when you're not like a foundry, for instance, and you're not in really high humidity environments, like in a pulp and paper mill, for instance. And then what it does is it also considers your worker clothing. What are you wearing? Because is it allowing for sweat evaporation? It also takes into account radiant heat and from direct sunlight or really high-powered lights. And then it also says you need to take measurements taken at the work site. You can't rely on your weather app to be able to say what the temperature and relative humidity is, because it might not be localized to you. This is different from some other jurisdictions which allow this. So what it does is you have a calculated value which either goes into humidex 1 or humidex 2, and you can, if you're acclimatized, you can go into the humidex 2 if you're doing sort of moderate activity. But if you're not acclimatized and you're doing moderate or heavy activity, you have to go into the humidex 1. And all it is saying that if you're acclimatized, etc., you can actually have a higher humidex, and then these are the types of controls that you would have to implement at these levels of humidex. So there are some other tools out there that we looked at. So there's this OSHA heat safety tool, which is really nice and snazzy. It does something different though. So I'll compare the two, the IATSE 891 heat stress app and the OSHA app. So the OSHA app has really great things like it's in schedules reminders for you. It gives you a bit of education, awareness, and signs and symptoms, etc. You can use your local temperature and humidity from your phone location or a user input. So you could actually use your weather app in this case, right? Which is not something that WorkSafe BC allows. And then you get a heat index that says feels like temperature. So you've seen that with weather reports. It'd be like, oh, it's 30 degrees Celsius today, but it feels like 42 degrees Celsius, right? So you've all heard that in the weather channels, etc. And so it'll give you a heat stress risk category and some precautions around that. So that's really quite nice. However, we go a little bit further because we're trying to meet the guidelines at WorkSafe BC. So the OSHA app really stops here at the humidex value or the feels like temperature value. Whereas for the IATSE app, we actually ask you about clothing adjustment and work intensity and radiant heat. Now, IATSE said, let's just assume everyone's unacclimatized to be more conservative, indicating really that in BC, it's really difficult for us to have acclimatized workers. So they wanted to just get rid of that question, but it is there in the back. We can add that in at any time. And then we get a humidex 1 or 2 value that you can see, and then the types of controls or response that comes out of that. So I actually love people to be able to follow along if you can, but if you can't, that's okay. The slides will actually just give you a good flavor as to what the app looks like. So if you have it open, I'd request that you open it up. And you have to say at first that you're not in these places. So you don't have any sources of direct heat infrared radiation coming from industrial equipment. You don't have high humidity levels produced by industrial equipment. And you're not wearing impermeable, semi-impervious clothing like the Breaking Bad boys in the to the right of the screen there. You can't be doing that because then you should be using other methods to assess risk, not this humidex method, right? So what it does is it asks you for the temperature and the relative humidity. So if you want to type in your temperature and relative humidity, I don't know if you have a hygrometer handy, but I have one right here. That's on my shelf. Or you could just make one up, or you in this case, you can look at your weather app and see what it says. So if you want to follow along there, and then it asks you for clothing. What are you wearing? And the film industry actually was wanting us to put costume related things in here. They wanted us to put certain other film related clothing in here. But the reason why we kept them as the WorkSafe BC clothing is because this information, these sets of clothing have evidence behind them. We didn't want to make an assumption that, someone's costume, Queen Elizabeth's costume is the same as something, right? So we're asking the user to use this as a tool, and then they should choose the closest thing. So this is sort of our next poll activity for the scarecrow. What do you think is closest to what the scarecrow is wearing right now? Yeah, I would agree. Coveralls over summer clothes. How about the lion? Yeah, me too. I would agree with that. Coveralls. And then how about Dorothy? Oh, sorry. Is it Dorothy next or is it another person? Oh, Lion and Tim. Yeah, Dorothy now. Dorothy. Yeah, summer clothes. Yeah, I would say the same thing. And so, of course, with crews, we have people wearing different things, but they can choose what matches most closely. And then for radiant heat, you can answer whether you're in direct sunlight or in an indoor area with really high powered lighting, which is the case oftentimes in a film set. And then what the activity level is. So we go from light to very heavy, and there's definitions when you slide that bar. So in this case, is Mr. Anderson and Agent Smith. There's no poll, but just kind of imagine, what do you think they're doing? Is it, would you say it's light, moderate, heavy, very heavy? I think this scene was probably pretty heavy, very heavy. So anyways, so we would put that in there, and then you would come out with this ability to edit your entries as a summary of what you input. So you can use those pencils to actually change anything if you wanted to. And then it generates a report and an appropriate response. And so what it does is there's a little needle that comes up, and it'll go to high or moderate, et cetera. And it'll actually say what WorkSafe BC says in that chart I showed you earlier. And then we have a little note that says, hey, if you want more information, please go to this website, which is the IATSE website. It gives more information about your rights and things like that, and how to report if you're in an environment where there's high heat stress risk. Wait, oh, I wanted to make sure that I provide this messaging, which is, it is the employer responsibility, right? So even though members are using this app, it's sort of a screening tool for them, but it's a way for them to approach their JOHS or their immediate supervisor to ask about that. We don't expect that the employee is going to implement these responses. It's up to the employer to do so. It's to have that conversation, and that's why we refer them to the IATSE website, which explains that. You know, they're not the ones that are going to be like, okay, let's close down the production. So we wanted to be really clear about responsibilities. Oops. So essentially, this heat stress app is a really quick and easy screening tool. It was built for IATSE. It's built for the film industry. However, it's free to anyone. If people feel that they want to use it, they're welcome to do so. It's IATSE is really happy to have it used by other people. So we have had other jurisdictions use it, and we always have the caveat: this is WorkSafe BC sort of compliant, but it's not. It may not be compliant in other areas. So, but people are using it. So I know that people in Hollywood were using it, I guess, before the strike. And then we know that people on the East Coast have been utilizing it too, of America. So it's been used in other jurisdictions with those caveats. So this is just a quick, easy screening tool. Can only be used under certain conditions. And of course, we say in it, you never ignore your heat stress systems. Don't rely on this to say you have a heat stress risk. If you are feeling symptoms, right, you would get help. Of course, there's always education and training that goes along with something like this. We can't just provide it to people without that lack of training. So moving on to wildfire smoke, we know that in BC, it's mostly a summer issue. It also often follows the heat stress issue, right? It also is a problem for indoor and outdoor filming activities or live events. Again, we have vulnerable populations that can be affected by wildfire smoke. And there's, like I said before, there's no clear occupational guidelines here in BC. So what we've been doing with clients is actually we've been helping them build their exposure control plans and just letting them know they need to do something. They need to do something ahead of time. Know what they're going to do around heat stress, know what they're going to do about wildfire smoke before it becomes an issue. So ActSafe has a really nice heat stress exposure control plan template on their website. You can go on their website and actually take a look, and you can fill in an exposure control plan for heat. That's really nice, trying to make it simple for people in the industry. There isn't one for wildfire smoke right now, but it follows the same sort of things that you would need in an exposure control plan around background and roles and regulation guidelines, health effects, risk assessment controls, and records. So all of those things should be in a wildfire smoke exposure control plan too. So this is just an excerpt from one of our exposure control plans for a production in BC. And so they decided to choose actions above AQHI of 7 or greater, and they have to do certain things. So I'm not going to go over exactly what they're planning to do, but the message here is they have a plan now. They have at certain levels, these are the things they're going to do. At a level greater than this, then they no longer, will be filming outdoors, for instance. So people always ask me, Mona, when should we shut down this event? Like, oh, well, there's no good guidance out there. So we have to come up with that. You have to come up with that yourselves in consultation with, people who know something about exposure. They don't like that answer because they just want to know, do we shut it down or not? And it's difficult because there isn't really good guidance here yet. Okay, so how do you get at some of this air quality information? So when I started working on this presentation a while back, I realized that your phone actually has a lot of really good information on the weather app. So if you go into your weather app and you go into your local area right now, you'll see air quality that comes up, and it'll say what the number is. And if you click on that air quality section, you'll come up with this black screen, the next screen that you see to the right of it. It'll actually say what the it's on the AQHI. It's telling you about health information, that this is, you know, good air quality for outdoor activities, or it might say, you know, vulnerable populations probably should avoid outdoor activities, that sort of thing. It'll tell you what your primary pollutant is and what it's due to. It doesn't give you all the details of like your PM 2.5, et cetera, though. So you can get that information by going on to either a Gov website to look at PM 2.5 or a Metro Vancouver website if you're in Vancouver. If you want the AQI information, which is EPA, you can also download an app too. You can also get AQI from your phone. The same place, if you looked up Phoenix, for instance, you would see air quality. It looked the same as that first page, but then the second page you pull up in Phoenix would be based on the AQI. And then you can find any other jurisdiction too that has air quality index information, but it'll be their air quality index information. So the scales are all different, but at least you can access that fairly readily. And I thought that was really, really cool. For air quality health index, you can also go to WeatherCan and you can get this information too. So what we've been telling productions is that they need to start considering heat stress and wildfire smoke in their call sheets. So call sheets are these things that are sent out the night before, and it talks about all the things that they're going to do the next day. So oftentimes they'll have things, safety related documents that are sent along with the call sheet. So sometimes it's about fog and smoke, sometimes like fog and smoke they generate on set. Sometimes it's about maybe they're working on water, maybe there's going to be like some stunts and things like that. So they send all these extra documents that come with the call sheet. And the call sheet just says that this, you know, we're planning to do it this time, we're coming in the morning at 6:30 a.m., we're planning to do this thing, this, that, and this. And then they'll have like, you know, what the actors are doing, what the scenes are, etc. But oftentimes they have like weather related stuff on the top. Very often they'll say, oh, tomorrow's expected to be, you know, 25 degrees Celsius and, you know, sunny. So they could start to send information around what forecasts around wildfire smoke and heat. So right now we've made that suggestion. I'm not sure if film productions are starting to do, well, right now they're not working, really, not many are working because of the strike. But we're hoping that like next summer, for instance, that they'll start to do that with their call sheets. So there are different tools for assessing AQHI too. So we talked about using some of that public health information that's available, but Cal OSHA says you can also use direct reading. You can do your own PM 2.5, and that's also in the exposure control plan we gave to this production. We said you could do your own, especially if you're indoors and you still want to know whether, you know, indoors is an issue. So there's direct reading you can do, there's wildfire smoke prediction stuff, there's wildfire information and smoke assessment tools. All these tools can help you predict, you know, whether there's going to be an air quality issue. So you can look at, for instance, this BC Wildfire Service app. We've been using this extensively because over the summer we've been looking at wildfires in and around the province. Gives you a general sense of proximity to a wildfire, which may or may not be directly related to the air quality, but oftentimes is. You can also look at some of these governmental websites, as I was saying before, gov.bc will give you AQHI and like PM 2.5 information. You can do, like I said, routine monitoring, but there's also strengths and weaknesses to each of those. You know, you can do it as high resolution, but it's not source specific. So if you're just doing PM 2.5, it's not specific to wildfire smoke. So for us on set, for instance, we've been doing this a little bit, but they also produce their own fog and smoke indoors. So we have to get like a baseline when there's no fog and smoke being produced on set first to be able to figure out what the wildfire smoke component is. And then then they put in fog and smoke as well. So it's kind of interesting in this type of industry where they actually produce their own smoke as well. There's this remote sensing that you can do as well. It also may not measure where you are though. So that's one of the issues with using some of these other air monitoring stations, etc. Forecast modeling may not be precise. this sort of fire information, smoke proxy information, like looking at where the fires are, that may or may not be related to the actual air quality. And then this smoke proxy visibility range, we have been doing a project, actually, I think Drew's on the line right now. We've been doing a project with BC Wildfire where we look at sort of guesstimating if it's like smoky or not, and then actually comparing it to real measured smoke levels. So monitoring the actual smoke levels to see if we can start to rely on people's visual assessment of the smokiness and the air quality. So we know from like a hierarchy of controls perspective that we can start to implement that for wildfire smoke. We can try to eliminate, try to get rid of the fires. That doesn't really work, but can we move our location away from smoke? Can we reschedule the outdoor work so we're no longer in amongst the smoke? Can we provide enclosed structures or vehicles where the air is filtered? So at least we're keeping people in more contained environments, clean environments. Can we do things like reduce the time spent outside, reduce the intensity of the outdoor work? So these are all questions we ask, and we try to implement them in exposure control plans and have a plan around when we do these things. Respiratory protection, sort of that last line of defense, N95 respirators or other appropriate elastomeric face piece respirators. Of course, if anytime you have a respiratory protection program that's mandated, then you need to have, anytime you mandate respiratory protection, you need a program that requires fit testing, training, etc. And also, just in this industry, the actual actors and the talent cannot wear the respiratory protection. So that's always an issue where, why is the crew wearing all these N95 respirators and I'm not? Is there's the problem, right? So for indoor air exposure, people often ask us, like, are we getting exposed indoors? How do we know? So what can you measure? And so we can measure some things. We can measure temperature and relative humidity, maintaining comfort levels. We can measure CO2 to see adequacy of outdoor air ventilation. We can look for CO to see if there might be any combustion contamination. We can look at VOCs, and we can actually even look at fire VOC markers as well. We can do that particulate measurement, the PM 2.5 or the 4 or the 10. And we can actually look at vegetative char and soot and ash when people are really interested in, how much has come in and how much has contaminated an environment. So the pathways, there's several pathways for smoke to come into an indoor facility. So most common are like windows and doors and things like that, but we don't really think about foot traffic, and that can happen too, where you can have people traipsing in dust and soot and things like that from shoes and clothing, sort of interstitial spaces, and the HVAC system itself can bring it in if it's not properly filtered. So I had a colleague who takes care of the health and safety on Broadway in New York. And I don't know if you remember, early in the summer, New York was sort of enveloped by smoke, and it was all over the headlines, and they were blaming Canada at that point, and they during that week, though, on Broadway, there was a production where, the audience members were all sitting in the audience, and then they suddenly saw all this smoke billowing in from the air diffusers from the top of the ceiling, and they didn't know what was going on at first because it was really visible. It looked like something was burning, and they evacuated the site at they evacuated the production, and they had to close down the theater for the day. And it wasn't because there was a fire immediately there. It was because of the smoke they were just bringing in from outdoors with no filtration. And so after that, they decided to plan for next time, and they are trying to implement better filtration on their HVAC systems so they can avoid this in the future. There's also can be leaks and things like that in HVAC units too. So people often say, is it safe? Is it not safe? And as a hygienist, it's really hard to answer. There's really no, I'm going to use, for lack of a better phrase, smoking gun, right? that we can utilize. So there's no one chemical or particulate that will say, yes, it's safe, or no, it's not safe. However, you can do a bunch of data collection, and you can get an idea of what's happening in that environment. And then what's really useful at that point is to see You know, if we have a baseline and we do some controls, we can actually compare to the baseline. So that's useful. Like anytime we've been asked to like sample soot, for instance, it's like, it's really hard to interpret other than we're finding some, right? But then if they clean it, then we can sample it again or wipe it again. And then you can see, oh, you know what, it's much cleaner than it was. But it's difficult because there's really no standards around what is allowed from a soot on surfaces perspective. So applicable controls, actually, some things work and some things don't work, and some things will actually contradict each other. So we've found that some things that people are doing to maybe mediate heat stress, like by opening windows or by opening up the HVAC ducts without filters, they're thinking they're getting some air in there. It's not as hot, but then you might be bringing in wildfire smoke. So anyways, things that seem to work and not work are listed here. So opening unfiltered HVAC intake air dampers doesn't work. Closing them, yes, it's better. Keeping windows and doors closed. Running HVAC fans through filter works well. And using portable indoor HEPA filters. A lot of film productions rely on that because they don't have proper mechanical systems either in their warehouses that have been modified to become studios. Running wall-mounted air conditioners doesn't do anything because it's just recirculating that air. So in conclusion, what we were discussing today are hazards that are not generated in the workplace, but we can still use the same sort of risk assessment lens to address these different situations and these populations. And of course, we know heat and wildfire is not going away. Different jurisdictions do things differently. I'm always curious as to how other people are doing things because we might be able to find best practices. There's lots of digital tools out there and more being created every day. So we're trying to use some of those and what are good ones to be able to access to help us. We need to share. We need to share, collaborate, learn from each other. And the number one thing I tell everyone, all my clients, is we need to plan. We just need to plan ahead. Please don't call me on a Saturday morning and ask me these questions. Let's do it. Let's do it in advance. So I don't know if we have time for polls, but we can just skip to questions at this point. Angela and George and Colleen.
Yeah, that's fantastic. Thank you so much, Mona.
Oh, you're
That's
welcome.
wonderful. I'm still waiting on the students to send me their questions, but I've got one to be